Thank you. So yeah, welcome everybody to the March 2023 meeting of Medicare for All Connecticut. Um, my name is Peter Cunningham. I'll be kind of facilitating, leading the meeting a bit here. So thanks all for coming out on this windy, rainy, snowy Tuesday night. So I have put the agenda in the chat for folks to take a look at. We have a guest here, Ken McGill from Connecticut Drivers United, who is driving a bill, or no pun intended, in the legislature right now to improve pay and working conditions for rideshare app drivers and delivery drivers in the state. So we've endorsed that bill and tried to help them get the word out about that effort. So he'll be talking about that a little bit. And we can learn about how to help them with that. But in the first, I thought we could touch on a little bit the Husky for All work that's been going on in the state. I believe we touched on that last month's meeting, which I wasn't here for, but that was my understanding. So anyway, yeah, Husky for All is a great organization here in Connecticut that pushes to expand Medicaid, the Husky program here in Connecticut. Husky for Immigrants, for expanding that to include undocumented residents of the state. So I believe they were originally trying to get anyone under 26 covered, regardless of their immigration status. I think that was downgraded now to 18 instead of 26, unfortunately, but it's still
Correct.
a worthwhile endeavor. They had hundreds of people testify in support. So I'll drop some links in the chat. There's a great Hartford Courant article about all that effort, and the reasons for that are just, it should go without saying, when people in our community don't have access to healthcare, obviously they suffer, they're worse off for it, but it affects the entire community. When people can't go to the doctor, they get sick, they stay sick. When they stay sick, they can't work, they get other people sick sometimes, particularly in the age of COVID and all that. So there's a little about that effort. Here's a link to the bill that they are advocating for. And then Husky for Immigrants has a action network, a letter writing campaign. So you fill out this form, it'll send a letter straight to your representatives in Hartford. It's great, it's easy to do. We've used these ourselves. So fill it out, send it around to everybody you know, post it on Facebook, Twitter, LinkedIn, whatever you got. Just spread the word, because this is a really important thing. Obviously, anything we can do to help expand access to healthcare is something that Medicare for All Connecticut is really interested in. So I don't know if anybody else here has been more intimately involved with the Husky for Immigrants campaign.
I've been a little bit involved. It's still a win. Even though we didn't get everyone until 26 covered, they still are taking it as a win that everyone up until 19, I believe it is covered. So that is a win, but they're still going to keep, and we're still going to keep pushing. They're very grateful for our support. I've tried to go in as a representative wearing all of my hats. But they're an amazing organization full of great people and a great coalition. And I'm very happy that Medicare for All Connecticut is a part of the coalition, and we will continue to be as they continue their journey. Because as we all know, healthcare is a human right.
Absolutely. And I think it was just recently they had it expanded to what, 13 on, regardless of
It might have been
immigration status.
I know
Yeah, so
it went to 8 and then 11, I thought, but you could be right, Pete. My memory
no,
is not good with this weather.
You would probably know better than me. I think you're probably right. I know that they got kids covered, younger kids covered, trying to expand it up too. So
Yeah.
progress is progress. Yeah, unless anyone wants to expand on that or discuss that anymore, I think Ken, you can take the floor whenever you're ready.
Yeah, I mean, I don't have a big complicated presentation, but I know some things came up in the talk I had with Rana and Pete. So I will say one basic thing about the bill and then tell you a little bit of the predicament we're in now and maybe get some feedback and discussion about that. By the way, hi to Zach, my friend from Southern. Nice to see you here.
Go out.
It's good to see you.
Yeah, you too. You too. So, we started off with a very large, so I'm like Zach, a professor at Southern Connecticut State University. I'm not a rideshare driver, although technically anyone could be. And I got involved in this through the local DSA and through friends and friends of friends and all people that I met. And found a really, really compelling group of rideshare drivers who are organizing in the best way possible by really making relationships with each other. By finding other drivers at train stations and at airports and in downtown restaurant districts where they often congregate, by building relationships, building groups on WhatsApp, talking to each other, sharing tips and tricks, describing the way they feel about Uber and Lyft, building an activist core and so on and so on. And it's been a really impressive group of people. I've been involved for about 6 months, but this group's been going for about 3 years. And for at least the past 2 years, they've had help of a law clinic at Yale. So these are Yale law students who have helped to draft bills for them and helped to do some of the coordinating of lobbying and some of the more political work. And also sometimes been involved in organizing and stuff like that a little bit. They began with a very large bill that called for all kinds of things: better security for drivers, better unemployment insurance, sick leave, all kinds of different aspects of working conditions and pay and things like that. And we were sort of slowly advised to pare it down. We had a bill last year that failed, and this year I've pared it down to 3 things. One is better pay for rideshare drivers. So, some of you might know that Uber and Lyft have really tightened the screws on rideshare drivers over the last couple of years. And where it was previously possible to make a decent living, at least at it, it's now very often sub-minimum wage work. Cars cost money to run, and these companies put all the costs of running the car on the driver. And drivers often find at the end of the year or the end of the month, or just episodically when their car breaks down, that they're actually in the hole from the work they're doing. So it's a complicated situation, but our pay legislation, the pay piece of our legislation asks for 85% of every fare. And we think that that's going to allow drivers to substantially improve their take-home pay. And it's also going to prevent Uber and Lyft and other companies from really profiteering on drivers and customers, right? Because if Uber can only take 15% of every fare, I know you guys think a lot about rates. This is the right audience to be talking about rates. But if you think about it, if Uber and Lyft can only take 15% of every fare, there's a kind of a soft ceiling, but a ceiling on how much they'll also push up prices in favor of their own profits. So we feel that approach is a good one. There are some minimums per minute and per mile that we're also calling for. Those are a little bit more complicated, but they do protect drivers in case of heavy traffic conditions and whatnot. So we have our pay call and then transparency. This is also the great crowd to talk to about information, because rideshare companies hoard information and not just profits, right? They really do not share things with drivers that are very pertinent to their livelihood. Like, how much is the customer paying for your ride? if the customer is paying $60 for you to drive them to Bradley Airport, but Uber and Lyft is only offering you 35 or 37 or 38, right? That's a real concern. So knowing how much that they're charging customers and having that transparency is really crucial. It's also transparency with the state so that we can get some better information. Uber and Lyft and the companies have all the information right now, and it's very hard to know what rideshare drivers' real objective predicament is without that information. So we're calling for transparency. So we have pay, transparency, and the last one is reciprocity, which is that Massachusetts and New York drivers pick up people in their states and drop them off in Connecticut all the time. They're allowed to pick up people in Connecticut to take back to their home state, but Connecticut drivers are not allowed to drive in Massachusetts and New York. So there, our law is very simple. It just says if Connecticut drivers aren't allowed to drive in your state, you're not allowed to drive in ours. And so the Massachusetts and New York legislature have sort of, elbowed Connecticut in general aside, and we're arguing that we need to push back. That one's actually relatively uncontroversial. So those are our three main predicaments. We had a bill hearing. The bill is doing very well in the Labor Committee. We're very happy about that. It has strong support in the legislature. We have good prospects, we think. But a couple days ago, the Labor Commissioner came out with testimony against the bill, citing a whole bunch of mostly spurious concerns about her ability to regulate this area, whether or not it was transportation or labor. So sort of claiming that since it's kind of has to do with cars and it kind of has to do with work, that no one can regulate it, and a lot of real garbage. We really felt that the Labor Commissioner has not done us any favors. She's sort of a centrist Democrat. So right now our predicament is we're in a good legislative position, but we're staring down a possible veto at some point. And we're trying to figure out right now, when do we apply pressure? Do we talk to the Labor Department more? They've refused to talk to us, even though we're driving the bill again. No, well, pun intended. Even though we're running this bill, the Labor Commission, the Department of Labor won't talk to us. And so we want to give them more chances to talk to us. We want to give more people in the Lamont administration more chance to talk to us. But we might also be served by just going out and protesting and getting camera crews like Uber drivers for some reason. So we think we can get local news to cover a rally in front of the Department of Labor. We think we could get them probably to cover a rally in front of the governor's mansion or whatever. But so we're sort of like, that's our strategic predicament right now. Yeah, I would love to hear any and all questions, comments you guys have. Go ahead. Yeah.
You're asking for suggestions. There's a ton of YouTube videos showing abuse of Uber drivers by obnoxious passengers. Those could certainly be used as part of a campaign to show that being an Uber driver or a Lyft driver can be pretty stressful at times, and that they do take a lot of abuse. Just a suggestion.
You're muted.
Now you're muted, Ken.
We do. That's a good suggestion. We especially need to pass those on to the press to hope they get into press reports. Some of them are staged, by the way. Some of the Uber abuse videos on YouTube are staged, but some kind of have a feel of recreations, maybe too, of real situations. But some of them also do seem to be real. So we take those safety and the, like you said, the stress concerns very seriously. We don't have the capacity right now to really run our own social media campaign, but you're right, there's a lot out there we can try to amplify.
So I'm looking at the Labor Committee now, And if you say you have strong support, that's fantastic. Excuse me. I know of at least one who would be a ranking member who would give you a very hard time. I know of two who would possibly 3 or 4 who would be supportive. And you don't have that many that you have to be able to push it through. It's where it goes thereafter that may be more of a problem.
Yeah, I agree. We talked to the ranking member. What's his name? Rob.
Yes.
Sampson.
Yeah, Sampson. Yeah. And yeah, I mean, he was just not very welcoming.
Mildly put.
Yeah. So, but I do feel you're right that out after the committee, we have serious concerns. And I'm just very concerned right now about a veto. And Lamont cuts all these commercials where he brags about raising minimum wage, but this is kind of like a backdoor sub minimum wage. And we do feel like we can push back on that with him.
Good.
But you
I
got to
hope
have strength. You have to be willing to put people in the streets, and you have to have direct action. You have to be ready to back up your, bid for new laws with direct action, and we know that. So we're really organizing for that.
Good. I hope you would take from your champions. You have champion legislators, I'm assuming.
Yeah.
I would take your cues specifically from them, because I know that with us, we've been given a lot of really good advice from our legislative champions to follow, and it has always come to fruition. So my advice would be to definitely listen to what they're telling you.
Yeah.
And, because they know their stuff. They know the special nuances of the behind the scenes things that we don't know, and they won't reveal to us, but
Yeah.
they will tell us what to do without revealing said nuances. So
Yeah, that
that
always
would
makes
be
me uncomfortable.
advice. Yes,
but you're right. We do have a champion. Julie Kushner is probably the closest. Yeah.
Great.
She's been really good. But she keeps her cards close to her chest. So for me, it's a relationship that's always a little bit fraught, because she doesn't want to overpromise, and she doesn't want to say too much, and she also wants us to organize and not make it seem easy. So we do listen to her, and we do listen to other people in the legislature who are our champions, for sure. We had a
Good.
very nice meeting with Martin Looney and Senator Duff, or Representative Duff.
Senator, I believe.
Senator.
Yeah, Senator Duff, and that went very well. So
Good.
we've got very good prospects in the Senate in
Well,
particular, which I think would be the harder one. So
we do have Action Network, as I know Pete told you, and we will certainly help you with that to drum up support, and you have our support.
thanks.
So it's at your disposal, as long as we continue to agree as a board to put our support, which we have. So we will help you with what we can.
Thank you. I mean, that solidarity in and of itself means everything.
And I met a lot of your members, or the members of when I was there on Thursday, because I was with my paying job, Keep the Promise Coalition, and I spoke to a bunch of drivers in the legislative office building, and they were such nice people. And I spoke to James. I never say yes. Thank you. From Yale.
James Bandari Alexander.
Thank you. Yes. I always say the first part of his last name incorrectly, and I didn't want to do that again. So thank you. And I spoke with him. He's like, come outside. You can stand up for your group. And I'm like, I can't. I'm with my other group. So I didn't get to stand outside for the press conference, but I did speak with a few drivers, and it was really cool. They were great people.
Great. Yeah, we had a good group there on Thursday. Were you there for the Labor Committee meeting?
No. I don't do crowds or people often. I like being virtual. But I had to go on Thursday, so
Okay.
no, sorry.
Cool.
Good. James has been active in our Medicare organizing as well. He was instrumental in helping push the municipal resolution that passed in New Haven. So James, great overlap between our two groups.
Yeah, he's good. He's sharp. He's a good lawyer, is my impression. I don't know much about being a lawyer, but my impression is he's a good one. So.
I also work with him in the Greater Hartford Reentry Council,
Wow.
but they don't do virtual meetings anymore, so I haven't seen him there. But yeah, I work with him in a few different places. It's pretty cool how the advocacy world keeps twisting and turning each other together. It's kind of cool.
Well, I mean, I think having somebody who understands the legislature is really important. And for us, that's James. So
Yeah.
having a champion is great, but also having like a Sherpa, because like, I don't really understand it and it's not my thing. I'm very into the ground level organizing. I appreciate that. I think I know something about it, but I'm not, the legislature is a bit mystifying to me sometimes. So, just having people that are willing to negotiate it and deal with it is really great.
Okay, cool.
How does this bill compare with current legislation regulating taxis insofar as there's any labor regulation in the taxi regulation law?
Well, not much at all. I would say that it doesn't match up much at all. There are some overlaps, for example, in a place like New York City, where taxi regulation and what's called black car regulation, so outside of Manhattan, but in New York City, you intend to have livery drivers who drive unmarked taxis, as it were, radio dispatched. And so those folks have done some things with the New York Taxi Workers Alliance, the Black Car Foundation, where they have created some sorts of legislation that overlaps in some way, specifically around things like workman's comp, right? So that Uber and Lyft drivers are covered, or at least in potential to be covered by workman's comp in ways that livery drivers in particular are in New York City. So there we've seen like a specific overlap where an attempt to regulate together, but not here in Connecticut. And in Connecticut, if you're a taxi driver, you're either self-employed in the strict sense, like you really do run your own business, and you have all your hand in every facet of it, or you're an employee and you're just a regular employee. And the problem with Uber and Lyft drivers is that they are kind of betwixt and between. The company controls everything about their lives. When they can make money, how they can make money, if they get deactivated for dumb things or for no reason at all. They can be kicked off the platform for virtually for any reason. And the algorithms will kind of feed them some good fares when it seems like they're not working as much or moving away, but then really sort of dry them out and not give them good fares at all for a long time. So the Uber and Lyft and these other companies just have a lot of power in ways that typical taxi companies just don't, where they have either self-employment, genuine self-employment, or a sort of employee relationship where they want the employees to work. Sometimes Uber and Lyft don't want their people to work. It's a really rough relationship. So it's a whole new model of how to think about labor, because Uber and Lyft drivers aren't employees. At least technically so far, they have not been sort of declared employees in any state. We've tried in various states to get that designation, but it hasn't really succeeded. And without that, then we need new kinds of legislation that give new kinds of guarantees that you've never seen before. So we feel that this is innovative. It's the cusp of the future. Gig work is not going away. Gig work is a new form of exploitation, and we're going to have to engage with this. And we see this as an important way to do that.
That actually speaks to, because I have to admit, when you first reached out to me and said, would Medicare for All CT be willing to, endorse this? And my first thought was kind of like, well, yeah, obviously I support you, but I don't understand what this has to do with,
Right.
universal healthcare. But then I thought about it for a second, and I started thinking about kind of the economics of Uber and Lyft and these apps, and kind of the reason they became popular in the first place, and the reason they were able to corner so much of the market in rides is because they were cheaper than taxis. And the reason they were cheaper than taxis is because they didn't pay their drivers anything, whereas taxis had employees. And now, even then, they couldn't turn a profit, so they have to jack up the prices. So now they're as expensive or more expensive in some cases than a traditional yellow cab, but the drivers are still not getting paid. So really all they've done is, like, the economics of it, it's not really innovative. They've just found a way to work around labor laws. That's the whole way it works. And if you think that they're going to stop at drivers, then you're crazy. They're going to try to gigify the entire economy. In many
It's so
cases, they
gross.
already are. You look at what's happening with healthcare workers and how burned out they are, and how travel nurses are staffing hospitals all over the place because nobody has full-time healthcare staff. That's ripe to be gigified. There's going to be nurses and healthcare staff, phlebotomists and whatever, working through apps without traditional protections, including health insurance. So this is a great way to kind of like push back against that, kind of stop this momentum from going on, because it's gonna happen to every corner of the economy, including healthcare, including maybe your job. And maybe, if you've got health insurance through your job now, if you get laid off and the only way you can do that work anymore is through some app, then you might not have it anymore. So it really is, if you kind of like pull back and look at the big picture, the reason that solidarity is so important is because, there really is a lot of overlap between our two, the work that we do in labor and healthcare. It's impossible not to see once you start looking at it.
Yeah, definitely.
Yeah, I had, when you were talking about that gray area between being an employee and being self-employed, I couldn't help but wonder. I'm very supportive of what you're doing in Connecticut, but in the past, the federal government has been quite strict about people who are self-employed having certain rights of independent, they have to be able to take work from a variety of people. They can't be in an office. They have to have their own equipment. And it seems as though, like, nationwide, this whole split between employee and self-employed is breaking down. And I was just wondering if you knew of any federal action that addresses it on a nationwide level.
No, other than that the Biden administration had said early on that they were going to give better protections to gig workers and specifically drivers, and then just kind of didn't do anything. So it seemed like the executive branch, the federal executive branch, was going to push through a requirement to treat these drivers as employees. And then they just kind of didn't do it. So I don't know what to say, like, other than like maybe someone will write a book or an article and tell me what's going on. But I'm pretty mystified, because you're right that it traditionally seems like these people deserve to be thought of as employees, if that's a right way to frame it.
Yeah, I think that the IRS would be, have a toehold in this issue. But
yeah, I don't know. Yeah, it seems like a way of skirting employment laws to me a lot, because like you said, they don't have control over being able to take work from different people. It's basically just a handful of apps that essentially cornered the market for labor in a way. Hey, Zach.
Sure. Yeah. I mean, that's exactly what it is, right? It's a way to undermine traditional employer-employee relationships and all the regulations and supports that workers have won over the years and further erode the worker security. And so what I'm interested in, first of all, I want to applaud you for taking on this. I mean, I think it's an issue that is in need of someone addressing it. And I think the long-term goal, as you suggested, is somehow finding a way to convert this arrangement into a employee arrangement with or to provide equivalent protection. And I guess what I'm interested in is what's the strategy? I mean, obviously you're working on the state level with your group, but is there a long-term vision to build towards, the kind of employment security that we want for all of these, for everyone, really, right? And I just thought I'd ask about that, about the sort of long-term goal here as well.
I would say that no, that's not well formulated. But when I formulate it to myself, what I end up saying, and I say this to other people, in the movement, is, okay, it doesn't matter whether you call them employees. Like, everyone is hung up that the federal government and various states have a thing called the ABC test on whether you're self-employed or really employed. And I think that for us, we are fighting for app workers and gig workers, regardless of whether they count as employees. We will take all the rights we can get for app workers and gig workers. And if you're not going to call them employees, that's fine. We have very scrupulously in all of our legislation avoided the word employee. And so I can't tell you the long-term strategy, but Zach can tell you on this issue, the short-term strategy is to punt. We're not engaging on it. Maybe we'll bring a lawsuit in some year. California is deep in that legal area right now, and it's a morass. They can't get out of it. It's in the courts. They're stuck. We don't want to be that. We want to deliver power and rights for these workers, regardless of what they're called. That's how I say it to myself, but that's really just me, because it's another big gray area.
Right. Yeah, that clarifies it a little bit for me. I think, and again, if you can get the protections, that's ultimately what matters. But it's a question, I guess, of how to get there.
Yeah. Yeah. On the first day I was up at the Capitol in January, I met some people from a group called Connecticut Nurses United. Do you guys know them? What's the deal with them? They seem really interesting.
We have met with a few people from their group, and the majority of, well, at least their leadership is for universal health care. We haven't spoken to the membership as much as we have spoken to leadership of National Nurses United. For Connecticut, the Connecticut chapter leadership we have spoken to, and they are very interested. We have only had them at one or two of our meetings, and they never kept coming, I should say. But they're a cool bunch of people. That's
great. I wonder if they have any union backing.
They do. National Nurses United, I think.
Okay.
I am correct, Dr. Brewer. Sorry, Phil.
Okay. They are an outgrowth of the California Nurses Union,
Sorry.
which is very militant, and I mean that in a superbly positive way. Some people use militant as an insult, and they get things done. They are very well organized. They played a big role in the Nevada presidential elections. They're really dynamite.
That's great. I'm really glad to see them here in Connecticut, and I would love to see some configuration, even of all the different labor groups who are kind of new labor groups, you know, because we have our own issues with established labor unions who have really messed this issue up in a lot of ways. But I think there's a growing wave of a new kind of labor organization like Starbucks United, Amazon Workers United, everything with United in the name basically seems to be doing things a little differently. And I really love them. And I immediately saw the Connecticut Nurses United and said, these are the people I want to know.
Yeah.
Yeah.
Except for United Airlines, but
yeah, that's about it. I think, you know, we're really glad to meet you guys. I know a bunch of you already, but you know, like I told Pete before, whenever anyone asks me about a politician, I say, well, what's their position on Medicare for all? Like, I just can't believe that Rosa DeLauro, you know, is not, and that bugs me so much. And everybody in New Haven is so proud of her and loves her so much, but like that just really sticks in my craw that we have such a powerful representative and she's not come out for it.
She has her own Medicare for America.
Which she's very vocal about.
Yes, she is very vocal about it.
Oh, what is that?
Which is what
it keeps the insurance companies in power.
It's basically it's a pretty robust public option bill. To her credit, it's not a bad bill at all. It's just the only time she ever brings it up is to deflect from people giving her shit for not supporting Medicare for all.
Correct. Yes. Thank you. I couldn't say that, Pete.
Allow me.
Yes, she's very, very friendly with my family. She loves my family. My family loves her. So I have to be diplomatic. Anyway, so does anyone else have any more questions for Ken?
Do you have any like letter writing campaigns or anything that we can help amplify?
I'll put our petition. Let me grab our petition link and then I'll put that in there.
Super.
And I did put our little bill in there too, Professor Zach.
Thank
Sorry.
you. Thank you for highlighting that one.
myself.
Yes. The
Yeah, we love it.
employment bill, SB 151.
Yes,
Yeah.
sir.
I think I clicked on a couple of your stuff already here, but I'll get that one too. Wait, what's the bill you guys are working on?
SB 151. This is a bill that the National Jobs for All Network had introduced this session. It's before the Labor Committee and is currently going to drafting status. Hopefully we'll get a vote out of committee.
All right. Very cool. All right, well, if that's it for me, thank you guys for having me.
Thank you, Ken.
I'll let you conclude your business, and I
and
hope to
good luck.
see you on the next go around when our paths cross again.
Absolutely. Thank you so much, Ken.
Hey, good to see you.
And feel
Yeah,
free to
good to see you,
continue
Zach. I'll
to
see
join
you.
us. Continue to
anytime.
join us. We'd love to see you.
Okay.
Thank you.
Thanks, Ken. Great. Yeah, thanks again to Ken. And yeah, I think that pretty much does it for tonight, unless anybody has anything else. I know did want to have a brief moment of silence for Dr. John Batista, who was just brought to my attention, passed away recently. He was a psychiatrist here in Connecticut who was very active in the local chapter of Physicians for a National Health Plan. So he was a really active and capable advocate for healthcare and for expanding access to it here in Connecticut and elsewhere. So he will be missed. So I don't know if Rana anybody, or if anyone else wants to say anything more about John.
Yeah, I just wanted to add, he was one of the people who wrote legislation for universal health care in Connecticut back in 1999. And so he's been ill for several years, so he has not been active. But I guess the one other thing I wanted to bring up is the cause of death was COVID. He had had chronic cardiac issues, but he and his wife Justine had visited California recently, I think in late January, to visit their daughters and their grandkids whom they hadn't seen for like 3 years. And they decided to take the risk. And she figures that they were exposed to COVID during their travels. So I think, as we're talking about healthcare, I don't know what we can do about it really, but for the disabled community, for the people who have chronic health conditions, COVID is still very much with us. And it seems as though, with the tests and the immunizations, slowly, getting transferred to the private sector so that, people will not necessarily be able to afford to test or to get care that they were getting for the first couple years of this pandemic. And, it just kind of highlights what's wrong with our healthcare and how it really is impacting everyone, but especially the people in our disability community and in our health impaired community who still don't feel like they can have regular jobs or go out in public. So I don't know. Sorry about that not being a very cheery note, but it was kind of a stark reminder that we're still in the middle of a health crisis fighting for this.
Absolutely. Thank you, Rana. That was very, very well said. I'm sure Dr. Batista would have appreciated the sentiment.
Yeah, we're still in the period of the era of COVID, and this month, the federal emergency declaration is going to go away, and we're going to see a bunch of people lose their Medicaid. It's going to get kind of ugly again.
I think food stamps are going to, so that's going to push
They
people back
already
into the work.
have.
That,
They
yeah,
already have.
Yeah.
Mhm.
it'll push people back into the workforce who otherwise wouldn't have they needed to. So more exposure. Yeah, it's
On that kind of note, I would like everyone to please keep in mind that I am going to try to mix more of my paying job with Keep the Promise Coalition with Medicare for All Connecticut, because that reminds me of all of the ridiculous asset and income limits for the benefits cliffs that are out there with all of our I can't remember the name right now because of the weather, but benefits like SNAP, like Medicaid, and each individual program have different income and asset limits, and they're arbitrary most of the time. So ridiculous. So, I am going to start mixing that together because it's really harmful to our economy. If you have an entire workforce of people who cannot go into the workforce because if they make 50 cents over their income limit, they lose maybe not just their food stamps, but they can lose their rental assistance, they can lose their Medicaid, they can lose everything. So, when we say, oh, welfare state, no, it's not worth it for families to go back to work because they lose everything. So you're penalized for working and trying to better yourself and your family. You're penalized. So when there is such a shortage of workforce, maybe if we did something to change our benefit cliffs that we have that are back from at the beginning of time, and we went with the cost of living increases or COLA instead of when you get your cost of living increase, guys, for, I mean, know you, a lot of you know this, but when you get that cost of living increase on your disability payments, not only does your food stamps decrease, but your rental assistance decreases and your Medicaid spend down increases. So your 50 cents that you got is already subtracted like by $1.50 by the time you're done. So that's how our current system works. You know, just so that has a lot to do with all of us too. And along those same notes, I have a very important bill that is going to be put through the Human Services Committee that has some very scary language attached to it. The bill is SB 10. And I'm not exactly sure, to be quite honest, what the title of the bill is, but I will look right now. It is an act promoting access to affordable prescription drugs, healthcare coverage, transparency in healthcare costs, home and community-based support for vulnerable persons, and rights regarding gender identity and expression. So there are a lot of good things in the bill, a real lot of good things in the bill. And it especially has to do with community health workers. However, there is some language that is not good. So it is in sections 11 and 12, should be replaced with a different bill, SB 991. And it should also be added with requirement of stakeholder input from consumers, advocates, and advocates, including people with physical, mental, and developmental disabilities, into the Medicaid state planned amendment. And we want this to be submitted by the Department of Social Services with no involvement by the Office of Health Strategy. For those of you who were with us last year, the Office of Health Strategy has this primary care roadmap that they have been trying to push for value-based payments, which they think are good. Value-based payments are not good for those of us who have disabilities and complex medical conditions. It will do nothing but reward doctors and facilities for seeing patients less. It's really, really bad. And we have a lot of really, really good advocates working on these things with us, and I trust them implicitly. So I sent the information to Pete, and Pete is our Action Network guru, thank God. And he will set up all the letter writing, and I'll send you all the human services emails, how it's done in Action Network, Pete, because I have that already set up. But I would love as much support as I can get with this, because the language is really dangerous, guys. We don't want anyone to have value-based payments. It will really hurt those of us in the disability community. So, and it's like an urgent matter. It's the same push as last year with the primary care roadmap. I'm scared for this. And a lot of people may be thinking that what they're doing is a good thing to help with putting more community health workers to work, but not in this way. We can't do it this way. It needs to be done the right way. So, and that's kind of, if anyone has any questions, please always reach out to info@medicareforallct.org. And, you know, we will help you and get back to you as soon as we can. And, you know, anything, please reach out. Always feel free. And if you have any questions, we have a few more minutes. Thank you, Rana.
I don't have a question, but I guess I want to give people the heads up that we haven't really started doing this yet, but as people in this group probably know, our bill to try to get an economic study for a state single payer system really went nowhere this year. And so we had already decided before we submitted it that we would be doing fundraising to get an independent study done. So we have not quite started that. It will probably involve about $20,000 of fundraising, which is a drop in the bucket, you know, for the state budget. It's a little bit more for an independent group, but just, you know, stay tuned. And if anyone really likes working on fundraising for a good cause, let us know, because the information really has to get out there, that not only would that give people the care they need, but it would actually cost the state much less than what we're paying right now. That's all I
Zach,
got.
Zach, you had a question?
Well, no, I was just gonna pick up on some of what you were saying about the benefit cliff issue, which, as you know, is a major concern of mine, and it's certainly related to the lack of universal health care benefits, because if we had universal health care benefits, the benefit cliff would not be as big an issue. But that having been said,
Yes.
the benefit cliff bill that is before the legislature right now, which I put a link in the chat to,
you.
6629, also eliminate or extends rather the extremely short time limit in our TANF program to the federal limit of 60 months. But it also does, at least in the context of the TANF program, it does some things around the benefit cliff. I mean, benefit cliffs are broader. It's related to federal policies. I'm sure many of you know, but this bill is moving, and I think we might be able to get it through. So any effort that this group wanted to put towards that would certainly be appreciated by those of us working on that one. So thanks.
Thanks, Zach. Thank you for mentioning that. I appreciate it. I can't always keep all the bills that I'm working with in collaboration and coalition with. I can't remember them all. So thank you. Anything else, guys?
I think that's it for me. I'll send out round up some of the links to the efforts that we got mentioned tonight, and send out a follow-up email for folks to have those all in one place.
Thank you, Pete. You're amazing. Thank you all so much for being here. Thank you, thank you, thank you. Stay warm, and I hope to see you all soon.
Drive safe if you must. Yeah.
Yes, if you must. Take care.
Bye-bye, everybody.
Take
Good
care,
night,
everyone.
everyone.
Good night.